have this femur bone, what you want to quickly do is that you want to always recognize this head. And with this bone as well, you want to remember acetabellum sockets into the femur. And so as we look at it, right, this head should always be facing medial. But you as a student will still have the problem that this is medial, but also this is medial. So we determine what side is which by using either this structure. This is the trochanter overall, the greater trochanter, lesser trochanter, and this little boundary here between them, intertrochanteric crest. All right, this should always be facing posterior, and that is the easiest way. Head should be medial, the trochanters should be facing back, and there's no way to get it wrong after that. This doesn't make sense because this has to socket medial, so this can't socket onto anything, but it can right here. Now, with that in mind, this is our head, this is our neck. When we rotate this bone, greater trochanter, lesser trochanter, intertrochanteric crest. As we make our way down, this whole segment is your shaft or your diaphyses. And there'll be this bump here. It kind of looks like a little ridge here, and it's a bump. It's like pinching, right? Like you're pinching a little baby's cheeks. And then so this portion that you can pinch here is your gluteal tuberosity. And that is where butt muscles, the gluteal muscles, will attach and they allow for extension. But otherwise, gluteal tuberosity. With that, you'll see that there are more lines, and this larger, more profound line that has this sort of sharpness to it, but not really, but you can see kind of pointy here. This is your linea aspera, this whole entire portion. If I ask for it on the exam, I'll label it with a lot of lines to make sure that you know I'm asking for this line. And you can see that it breaks apart into two individual lines, one heading medial, and I know medial right off the bat because my head is always medial. So this is going to be called your medial supracondylar line because it goes a line going towards the medial side to the medial condyle. Then you have your lateral supracondylar line, and this is heading towards the lateral condyle. And so lateral condyle, medial condyle. With that, the area above it, epicondyle, epicondyle. This is going to be your medial epicondyle, lateral epicondyle. All right, they're named after that medial condyle. This segment here is your popliteal, your intercondylar fossa, which means it's a little location between the condyles. This segment right above here, this whole entire region between the two lines we mentioned, this is your popliteal surface, the back of the knee. When we rotate it, you have your patellar surface, and this patellar surface will be where the patella bone comes and meets that segment there. Otherwise, that is your femur bone, and in this example, this is a right femur bone. And cut.